Hello friends and welcome to this next episode of iLogs. And this is a very important episode. We get so many calls every day. थोड़ा दर्द हो रहा है, थोड़ी आंख कॉर्नर में लाल है, चुभन जैसा हो रहा है. I feel my eyelash has gone inside the eye. And the next question they ask is which drops, कौन से बूंद डाले या कौन से drops डाले जिससे मैं ठीक हो जाऊं. So this is a very common problem. We get so many calls every day, and this episode is going to discuss about what are the right drops and when.
That's right. It's very important to know which drop to use at what time, especially if you have some drops at hand. What is the expiry? Till when can I use those drops? Shall I put them in the fridge or not? These are some questions that we get so commonly by patients, and it's important to know that not all drops are to be used at all times at your discretion. Some drops are prescribed by us and us alone. So this is the first scenario. My eyes are feeling dry, tired and irritated because I'm on the screen the whole day. Whatever the profession may be, nowadays we are glued to our screens. So it's important to take care of them. How do I do that? How do I fix this tiredness in my eyes that's there the entire day, and in the evening I just feel like closing my eyes and falling asleep?
So this is very common, as we know that everybody is watching the mobile today 24/7. Even Netflix has become on the mobile now, the computer screens, etc. So yes, the solution to this is lubricating drops. Now if you go to the market, there are thousands of options. So you have lots of options, but you cannot pick up anything from the shelf because the composition of all these lubricating drops are very variable. So the best thing would be visit us. We have a fantastic dry eye sheet where we'll ask a questionnaire, and then there'll be a questionnaire answered by you, and we will actually determine the level of dryness which is there in your eyes. And then we will decide what's the right composition of the eye drops. तो आपकी आंख के लिए कौन सा बेस्ट बूंद रहेगा या ड्रॉप्स रहेंगे, this we will tell you after the questionnaire is answered, and that will solve your problem for a long time. So please just don't go to a chemist कि कोई भी बूंद दे दीजिए and you start the drops and that's going to solve your problem. It's not like that. It's very scientific. There's a lot of research done on this, and then there is an analysis made, and that's a conclusion that this will mostly suit your eyes the best.
So for customized and tailored treatment, even for something as simple as lubricating drops, visit us at Dr. Institute. So what about someone who has redness in the eyes, itching or allergy, but it happens every spring or every summer? It is seasonal. Could this be allergies?
This is also very commonly found. You are right, especially when it gets very hot. In summer, especially April, May and October, the eyes turn red, patients come watering, pricking, redness. Yes, this can be allergy. So there is something called a seasonal allergy, which is very common in kids before the age of 14. Even adults can develop this. Another common problem is pets at home. So if you have a pet at home, please make sure if you touch the pet that you wash your hands well with Dettol and then maybe touch your face or your eyes. Otherwise, these allergies are very common. So allergic to pet hair is also known. Some people develop skin reaction and rashes, and some people develop running nose, some people develop red eyes. So this is common. The solution to this is antihistaminic drops or anti-allergy drops, which has to be put at least for a month or so. Otherwise, best is visit us as Dr. Eye Institute, and we can actually diagnose it whether it's an infection or it's an allergy.
So a lot of people grab something called as redness relief eye drops or quick relief eye drops. What about these eye drops? Now when you want to look less tired or doesn't want your eyes to look very bloodshot, they just grab these drops because they're available over the counter and use them. What do you think about them?
So you had a late night party, you get up in the morning and your eyes are red. Now you have to run to office and you're going to face your boss and you're worried what's going to happen. Well, at the chemist, yes, you do get decongestant camphor cooling eye drops. They're not bad to use once in a while. They don't have much, they don't really have any side effects. But yes, these drops do work. They do decongest your eye, and there is no doubt that does give a cooling effect. They do work quite well, and they can be used once in a while. Nothing really much to worry.
So what if someone gets up with red eyes but they are swollen, there's a lot of discharge and there's a lot of itching? So what do you do? Is this an infection or is it an allergy?
So this is also very commonly found, that you get up suddenly in the morning and you find swollen eyes, One possibility is an allergy to the pollen in your pillow cover or in your mattress or in your blanket. The best thing would be to dry clean all of that, and if that's a pollen allergy, it will be sorted over the next some days. But if it's an infection, you'll have sticky eyes, matty eyes, lot of discharge coming out which is having a particular color, then it's an infection. Best would be to visit us at Dr. Eye Institute, and we can examine you and tell you whether it's an allergy or an infection. Now, infection, if it is bacterial, the treatment is different, and if it is viral, the treatment is different. You have to be very careful. Sometimes initially it starts as a bacterial infection and then suddenly gets converted to a viral. So it affects your cornea, and that will affect your vision in the long term. So very, very important to visit an eye specialist, make sure what kind of infection it is, get the right treatment and get cured the fastest. Normally the tendency I've seen in patients is they find it sticky, they start splashing tap water in the eye. Please, friends, avoid this. Do not splash tap water in the eye. If you want to clean it with a clean tissue, you get wipes nowadays which are medicated, and that will really help you. And this will prevent it from worsening at the moment. Make sure you don't touch all the surfaces. Visit the eye doctor immediately and start the treatment immediately.
So for infections, always remember, if you are in the habit of taking something over the counter and using it, it can be a steroid drop. Please remember that in some infections, steroid drops are not given at all. In some infections, they may be prescribed in a very careful and controlled manner. So always visit your doctor before using such drops and follow our advice. So which drops are a complete no-no? What would you say? Don't put this in your eyes at all.
So I've had patients who come with some gulab gel and they say, can we use this in the eye? And I always say, please smell it, then using it. I have patients who come sometimes with homeopathy drops and Ayurvedic drops. Frankly, friends, we are not been educated for this. I have no idea what is the composition. I have no idea what it's going to do to your eyes. So we cannot be even recommending it or suggesting it that this is safe for your eyes. So these are an absolute no-no. But it's up to you. You decide your homework. You can go to that subspecialty and ask them. They may recommend you whatever it is. But as far as our field is concerned, we do not recommend this at all.
Another fun fact, there are some patients who come to us with a drop which says that it will completely eliminate cataract. So these drops, very important that they are not of very scientific basis. So we have never seen a patient who has completely avoided cataract or not a semblance of cataract because of those drops. What happens is the density of the cataract keeps increasing, it becomes hard as a rock, and still some amount of vision may be available. This complication leads to a huge complication during surgery, especially in such patients. So avoid using such drops and shortcuts. The only solution for cataract, even in today's time, the most scientific solution is surgery. So don't try to skip that. It's safe and it's very advanced these days.
And just to remind you, friends, we at Dr. Eye Institute are doing laser surgery since 10 years. 1 decade से हम लोग laser surgery कर रहे हैं. So friends, this is episode about eye drops. If you have any comments, please feel free to make sure that you write to us and we will make sure we get back to you. Any confusion, write to us. This channel of iLogs is everything to do with eyes and eye care. Any more clarification, you can always WhatsApp us, write to us. We are on Facebook, we are on Instagram. Make sure you follow us and subscribe.
We hope you like this video. If you do, please share it with everyone around you and subscribe to our channel iLogs for more such interesting information.